My name's Dr. April Salcombe. I'm one of the F2 doctors working at Northumbria Healthcare Trust within the A&E department. So I use the GP records quite regularly with a lot of my patients, in particular the elderly who can't necessarily remember all of their medical conditions and what medications they're on, or if there's a patient that's got a reduced consciousness, so it's difficult to communicate with them, and it's really helpful because it can narrow down what you're looking for. If a patient comes in and they don't really know what's happened to them in the past, then you can narrow down what might be happening to them by seeing which conditions that they already have, which medications they take. It's also really helpful if you need to give a patient a medication and you don't know if they're allergic to it or if they've ever had it before, if it might interact with any of their medications that they already take, and it's really good at narrowing that down as well. When I started working here and I had access to the GP records, it completely changed because you just had much more confidence in knowing what you were doing was safe. At the old trust, you had to try as hard as you could to contact family members and members of staff at care homes and things like that to get the information that currently we can get a lot easier via the computer system. Obviously that's not to say that we don't contact family members and other members of staff that might be looking after the patient, but it just certainly helps it out of hours and things like that when you might not be able to contact people.